Welcome once again to Barnsley CCG Annual General Meeting. My name's Nick, I'm Chair of Barnsley Clinical Commissioning Group and I'm a GP in Athersley where I've practiced for 29 years with my colleagues. This year has been quite a strange and challenging year for all of us and that's why we're doing this AGM this way, because we can't meet in public and can't meet in face to face and we'd need a massive room to be socially distanced. Firstly, because of the challenges that COVID has presented, I'd like to personally express, and on behalf of our member practices and our CCG staff, some sympathy to anyone who's been affected by COVID. That includes people who've had personal illness, or the illness of a close or loved one, or the loss of a loved one, but also those people who faced other challenges, uncertainties around their jobs, loss of jobs, being furloughed, or trying to keep their business together. Certainly many of us have been unable to get the closeness with our family and friends that we'd grown accustomed to. Also, we understand over the summer there have been a number of extra challenges for our young people with the GCE and A-level results, and I hope those have worked out well for all of you. It's also been a difficult year and a challenging year for health and social care workers to maintain the level of services that they're used to maintaining without face-to-face contact. In Barnsley, we've seen our system partners, primary care, community care, mental health, the hospital, social care, come together really well, centrally organised, all participating, all contributing, and being flexible with a real can-do attitude. That has really benefited outcomes during this COVID period for the people of Barnsley. It's allowed us to prioritise who needs to be seen face-to-face. It's allowed us to put in the services that people really need immediately. Through all this though, we've also been supported not just by professional colleagues but by the Barnsley public. The way the public have come together to respect and carry out the social distancing and COVID precautions has been exemplary, and that's really helped us as well. It's helped us safeguard those staff that are needed to help you. However, COVID is still with us, and we've seen recently some relaxation of social measures and unfortunately recent surges in the numbers of cases up and down the country. That's a challenge to us. So a message to everybody, every member of the public, whatever they do for a living, whatever their circumstances, is to remain vigilant so that we can really get over COVID. There's a busy time facing us. Pressure on the health service currently is probably higher than it's ever been before for a number of reasons. One, we're still facing COVID. Two, we're trying to stabilise and reset the NHS and deal with a backlog of cases, and that has its own demands. And of course, winter is here and we will get our normal flu season and our normal winter pressures. So that places continuing and increased pressures on our health and social care system. However, I do believe that with the continued support of the public, with the support of all our partners in the system, we will be able to sustain good quality services. So, COVID has interfered a little bit with some of our commissioning plans, but we've still made progress and we've had some successes. Our children's and adolescent mental health services we've worked hard on with our provider and our early years offer, and we're hoping that this will look a lot better than it has done in the past, so we continue to work on that. We've established the largest primary care network in the country with 6 of our localities geographically in Barnsley and hosted by our GP Federation. One of the things that the GP Federation as primary care at scale has really been able to do with our neighbourhood teams has been able to provide the support needed during the COVID period for our primary care teams and general practices, and that's why you've all been able to still access some form of general practice, if not always face-to-face, electronically or through a telephone call. Without the Federation doing home visiting for us, without them seeing people with suspected COVID in their blue clinics, general practice in Barnsley may well have collapsed. We also continue to work hard on continuing healthcare and see improvements there. We've maintained our mental health investment standard and one of our focuses and a big piece of work in the background has been to get our Health and Wellbeing Board to adopt as its priorities mental health and a mental health partnership and support for early years. The CCG has seen some changes as well. Our AO Leslie Smith has, after 6 years, moved on to Sheffield and has a role in the South Yorkshire and Bassett Law Integrated Care System. We wish her well. We thank her for her hard work and commitment to improving outcomes for the people of Barnsley. And we now have a new accountable officer, Chris Edwards, who we share with Rotherham CCG, and I have every confidence, no doubt, Chris will want to maintain the outstanding rating of both our CCGs. So welcome, Chris. Additionally, through this past year, the CCG has maintained its statutory duties, achieved financial balance, and maintained our outstanding rating with NHS England. In order to have done that, everybody has contributed, and I'd like to thank all our practices, all our CCG staff, our system partners, and the public of Barnsley. It's been a combined effort, and the public of Barnsley particularly for respecting the COVID measures and for valuing what the health and social care service brings. So hopefully next year we can meet face to face and you can interrogate me a bit more, and I'd be happy for that. And we look forward to seeing you. Until then, the message for all of us is work together, keep safe, and we'll see you next year. Thank you.
Hello, I'm Chris Edwards. I'm the Accountable Officer at Barnsley CCG. I've just been recently appointed, but I'm delighted to be part of this AGM after such a successful year for Barnsley CCG and its partners. A key part of the challenges for 1920 was trying to create streamlined, seamless services for Barnsley patients, and it's great to see the progress that's been made during the year to achieve this objective, and it's good to see the firm foundations that we've got to build on in future years. As 1920 was finishing, the COVID-19 pandemic started to affect Barnsley and the health services. Luckily, it didn't affect us meeting our objectives during 1920, but when we meet you next year, we'll need to update you on how the Barnsley systems reacted to the challenges.
Hello, I'm Roxana Naylor, Chief Financial Officer at the CCG. I'm here to present the financial accounts for 2019-20. The CCG entered the year 2019-20 with significant pressures continuing in our hospitals. We had a significant financial challenge in that we had to deliver 13.1 million of efficiencies in order that we could balance our budget. I'm pleased to report that the CCG delivered all NHS England year-end business rules with an in-year balanced budget position, delivering full efficiencies of 13.1 million. We maintained our running costs within our notified allocation. We delivered all the requirements from a planning guidance perspective, with mental health investment standards being delivered, with increasing expenditure to our council in our Better Care Fund. Here's a look at the headline financial position. The CCG received in total funding of £450.9 million. This can be broken down into the following areas. Programme services, £408 million. This is the funding the CCG receives to commission services for the people of Barnsley. This includes hospitals, ambulances, community services, mental health services, and contributions to the council in relation to the Better Care Fund. This also includes the prescriptions issued by GP practices. We also received £37 million for primary care co-commissioning services. These are the contracts held with GP practices to provide primary care services in Barnsley. The CCG received £5.9 million to cover the admin costs associated with commissioning of services. How does the CCG spend the funding it receives? We spend £235.9 million on hospital and ambulance services in the year 2019-20. Mental health services, £36.5 million. Community services, £47.2 million. Continuing healthcare services, £26.4 million. Prescribing, £47.7 million. primary care £49.8 million, other programme costs £3.2 million, and running costs of the CCG £4.2 million. This pie chart shows how each pound received was spent by the CCG during 2019-20, with 52p in every pound being spent on hospital and transport services, 8p on mental health services, 10p on community services, 6p on continuing healthcare, 11p on prescribing, 11p on primary care services including national GP contracts, 1p on other programme services and 1p on CCG running costs. As the CCG moves into 2021, we are working with our providers to ensure we can deliver care closer to home and deliver the requirements of the long-term plan. This will see investments increasing in mental health services, community and primary care. This is clearly a nationally challenging environment given the impact of COVID-19 and the impact this has had on health services. The CCG remains committed to using this funding it receives to improve and deliver the best outcomes for the people of Barnsley. Thank you for listening.